Welcome, guys, and thank you for tuning in to another episode of the Meat Med podcast. Now, today I'm joined by my very special guest, Megan Pfeffer. I think that's how we say your surname. I hope I said that right. We didn't practice. Megan is joining me today from Melbourne, and Megan is a nutritionist who does a lot of work in the low-carb keto space with patients for lipedema, lymphedema, and lots of other issues as well. So, Megan, perhaps you can give our listeners and viewers a little bit of background about yourself.
Sure, happy to. Well, firstly, thank you so much for having me here. It's great to be talking with you. Absolutely thrilled to be talking to anyone about keto, carnivore, low carb, anything in that space, but particularly so in the lipedema area because it's very much an area that needs advocacy and needs awareness raised. So I'm a clinical nutritionist. I've been in private practice for the last 5 years. I've also worked with organisations in the US and am now an advisory board member for Lipoedema Australia. So I do specialise in low carbon ketogenic therapeutic lifestyles for women in particular with these conditions because it's something that I do have myself. So lipedema is it's a loose connective tissue disorder. We also call it a fat disorder. Some people refer to it as painful fat. So it's a very separate disease to obesity and separate to lymphedema, but it is often misdiagnosed as either of those because it's not taught in medical school. Or myself, when I first came across it, I had a client to me come who had lipedema and lymphedema and was utilising keto for those but needed some help. And I had never heard of the condition, so I had to research it. And once I started that, I realised I had the condition myself. So it's really not well known, but it is certainly in desperate need for, as I said, more awareness to be raised in this area. Because so many people are misdiagnosed, and we really do need people to be aware that there is a different treatment plan that's required for women with lipedema.
Yeah, wow. I mean, you said there that obviously we can go into the differences, of course, between lymphedema and lipedema. You mentioned that you have lipedema yourself, and that's kind of almost how you got started in this. And that's something that we hear so much. It's so very common on my podcast, pretty much all the interviews I've done so far. There's people saying they got into it because their own health issue. That it's something that's just so common. So you were doing, kind of low carb keto work already before that, but then that's how you got into the lipedema side of things.
That's right, yes. So when I was doing my health science degree, I just really was very aware of the low carb space at that time and was really, researching a lot of that. So we had some supervisors while I was studying who would support low carb or keto, but really the bulk of the knowledge throughout the course was taught as the flexitarian approach that we now know as the dietary guidelines and what we're taught about that. And the more I found out about the background around those and the more I researched myself, the more I realised that low carb and keto just made so much sense and really fitted for me because I really identified with the overeating carbohydrates, putting on weight rapidly when I reached my 40s and, having osteoarthritis in my fingers and those types of things. So when I finished my health science degree, I decided to go keto and did that with my mum, who was around 75 at the time, because she had severe osteoarthritis in her hands where she was finding it difficult to close her hands to use cutlery. And she was pre-diabetic and obviously had some weight issues as well. So we both decided to do that together, and it was just such a fabulous experience. We both, lost weight. The osteoarthritis that I had in my hands has all but disappeared. If I go back off keto, that will start coming back again. But so there were just so many health benefits that came with that. And the thing with my mum is that she was already doing low carb, but got some health benefits from that. But like a true carb addict, she was still overdoing the carbs on the low carb. So, was starting to overdo the sweet potatoes and any form of carbohydrate that was there, she was overdoing it. So I think, just determining which way is best for you to go, because of course, low carb, keto, carnivore, three sort of distinct entities that I think can be used for very distinct health reasons. And yeah, so that's something that each individual has to determine, I think, for themselves, whether it's coming from a carb addiction point of view where you no longer feel you can control your relationship with carbohydrates, or whether it's coming from a gut health point of view or other medical condition point of view where everything and anything seems to be irritating you and you need to sort of do an elimination type thing. So that's of course different for everyone, but it was certainly something that my mum and I found to just be wonderful. And then finding out that I had lipedema, which of course is different to lipedema, which is a blood fat disorder. This is a disproportionate body fat disorder. So you can really see it quite clearly. Once you know about it, it's quite obvious. Obesity you tend to see in the trunk of the body, whereas women with lipedema can have this disorder and quite advanced without necessarily having obesity. So they'll have this very small waist, no truncal obesity, but they'll have that disproportionate weight gain in the lower part of the body. It might just be the hips and buttocks. It could be the thighs as well. It might go all the way down to the ankles, where you'll see a very distinct ankle cuff, and the feet will be spared. And women can also have it in the arms, in the upper arms. But it can also, we're now discovering, a lot of the literature talks about it being in the legs and perhaps the upper arms, but we now also know that it really can occur in all kinds of areas. It can also be in the abdomen. Some people report having it in their scalps, on their head. So it's really, it can be quite extensive. But when you see the pictures of the advanced stages, it is quite obvious. It's a little harder to pick perhaps in the earlier stages, but it's something that we find women with lipedema respond well to lowering their insulin. And in the standard of care in the US at the moment, for example, they recommend following a dietary approach that helps to reduce inflammation and helps to reduce insulin.
Yeah, no, I mean that's a very good kind of description of what lipedema is, and certainly we know it predominantly affects women. Of course, men can have lipedema, but it's pretty uncommon. It's pretty rare. But if there are any men out there that are listening to this conversation and thinking if they have it, then yeah, often there will just be this very kind of unusual fat deposition, this kind of disproportionate fat deposition, and as you said, predominantly with kind of fairly classical obesity, if I can call it that. Yeah, usually it's whole body, kind of, whereas lipedema is very much, kind of central sparing.
Disproportionate, yes. Unless as we said, if obesity is involved as well, and it often progresses to that because it is a very socially isolating disease, and it also impairs mobility. So once people start to lose mobility, and people start staring at their legs because they're so unusual, they tend to really retreat. And so it certainly has that psychosocial impact where people do retreat. And look, the literature reports that lipedema in men is very rare. I have a sneaking suspicion that it is more common than is reported. It would be, I think anecdotally, certainly when you talk to people, the more women you talk to, the more people who say, oh, I knew an uncle who had this, I knew a neighbour who had this. So whereas the literature, really is saying that it's extremely rare, yet, when we do talk to women, it's more often reported. So I think, men can certainly have hormonal disturbances that can lead to that as well. But the other important thing I wanted to just mention there is that it's not just that disproportionate weight that's an indication of lipedema. There are other factors. The painful fat, for example, is a good one. And some women are in constant pain all the time with their legs. Some women's legs feel very heavy and achy, that they have to elevate them a lot. Sometimes there's that orthostatic edema, whereas at the end of the day, from being on your feet for a long time or even sitting a long time can create, fluid around the ankles and more fluid in the legs. Flying on airplanes and being in humid weather can create more swelling. But there's also, for other women, it might just be pain upon pressure. So if someone were to touch their legs, and it's very common for people to say, when the grandkids jump on my legs or when my cat jump on my legs, that's painful, I think is a really strong indication that something's going on, because that shouldn't be painful. Pain is not normal when there's pressure placed upon your legs. And there can be other things like easy bruising that can be telltale signs as well.
Yeah, no, absolutely. And it's quite different to cellulite, because there's going to be some people out there thinking, oh, I've got cellulite. Is this what lipedema is? I think that, as far as I'm aware anyway, the main difference there is that cellulite is predominantly cosmetic, isn't particularly painful, whereas lipedema is, usually, painful, and that can
Yes,
certainly be the difference there.
that's right. And, whether there is some kind of connection between the two, and one is a very mild version perhaps and one a more severe, or whether there are more, we don't know the genes that are involved yet. We know there are likely to be a few. We every now and then another one comes up that we can associate with lipedema, and they have found some things that link lipedema to lymphedema, although they are distinct and separate diseases. They could perhaps potentially be of the same genetic origin, or they have been the same family. The lymphatics micro sort of vascular leaky blood vessels and leaky lymphatics tend to be an issue with lipedema, so we know that is a problem. But in lymphedema, where the lymphatics are no longer functioning properly, in lipedema the lymphatics are still functioning, but because there's excess vascular growth, excess leakage from the capillaries, the lymphatics are not able to keep up with that. So there tends to be a lot of fluid that goes into the tissues, which is a very contentious issue at the moment of how much edema is in lipedema, and we don't need to go into that today. But certainly lymphedema and lipedema do have a link in there somewhere.
Yeah, no, absolutely. You mentioned there, of course, hormones. And hormonal imbalance, disproportionate hormones. I wonder if you can maybe expand a little bit on that and the hormonal issues that might lead to perhaps lipedema.
Yeah, well, one of the issues with lipedema is we don't really know the etiology, so we don't know exactly what's causing it, even though we've known of lipedema for over 80 years. So, but as far as we do know, it's influenced by hormones. So the major triggers tend to be times of large hormonal fluctuations. So puberty tends to be the most common time for it to be triggered. So women are living with this condition from the teenage years, and as you can imagine how difficult that is to be, to know that you're different and your legs are different and sometimes very heavy and large, and that you really stand out, can be very traumatic for people going through puberty. But also times of pregnancy and menopause, perimenopause, those things can also trigger. But not only that, those times of hormonal fluctuations, it can also be times of surgeries and chronic major traumas to the body and to the tissues, for example, that can also trigger that. I know myself that I had surgery. I had a double mastectomy a couple of years ago after breast cancer. I'd been through chemo. The lipedema hadn't been triggered. I was, quite a healthy, nice weight. I was a size 8 to 10. And it wasn't until I had the surgery of a double mastectomy that that rapid weight gain really sort of took off, and 25 kilos later over a 6-month period, that weight gain became quite rapid. So yeah, different things can certainly contribute to it. But they talk about, estrogen obviously most likely linked because it happens at those times. But of course, other hormones are triggered in those times. So there's links to progesterone and other hormones as well. And all of that links in with insulin too, as you know, that estrogen influences insulin so much, which again, at times of menopause, of those estrogen reductions and increasing insulin resistance is a factor at play as well.
Absolutely. Yeah, gosh, I mean, hopefully you're all well now from the breast cancer.
I am, thank you.
Good, fantastic. I'm just curious, did you have any like chemotherapy or any endocrine, hormonal therapy at all? Estrogen blockers,
Yeah, I did. I had 3 months worth of chemo, throughout which time I was very glad that I was already keto, and I used fasting. 3 days, I'd do 3-day fasts through chemotherapy, and found I had very few side effects. Nausea was one of them. I declined steroid in the first few sessions of chemo, and didn't feel that I needed them. I didn't want the blood sugar dysregulation and other factors with the steroids. I did need them by the last chemo because, funnily enough, the backs of my legs, the tops of the backs of my legs, which is a particularly problematic area for lipedema, were becoming sore. So I could tell the inflammation in the back of my legs had been triggered in that way. So I took the steroids, which helped. Yeah. But I did decline. Sorry, the second part of your question was the hormone replacement therapy, which, sorry, not hormone replacement therapy, but hormonal therapy. I declined tamoxifen. I wasn't, that wasn't for me, but obviously plenty of women do take that with hormone sensitive cancers.
Yeah, so I guess it was. And my question was going to be, was it maybe the estrogen, receptor blockers, tamoxifen, and so on that maybe was the issue? But obviously, you didn't have that. Yeah, curious. Obviously, we'll probably never really know. Was it the surgery that triggered it? Was it the chemotherapy that triggered it? And
Yeah,
you
well,
talk, of course,
the
about.
surgery was quite a few months after the chemo, and yeah, so it was really yeah. But you're right. I mean, it's hard to know, and it could certainly be the combination of both, which I would suspect would be at play too, given that the inflammation and pain that the chemo did cause certainly
Mhm.
didn't help.
No, it's certainly just could be likely to be both. It's interesting you mentioned there, of course, that the keto seemed to help you through the chemotherapy, and I've heard that before. I've certainly heard that a number of times, and that's very interesting. And why that might be, I could only kind of presume it's something to do with the autophagy that's involved reducing the inflammation, improve cellular repair, and so on. But did you have a baseline to compare that to? Were you kind of not keto for part of it and then keto? Were you just keto for the whole of the chemotherapy?
I had already been keto for quite some time before the cancer diagnosis. So
Mhm.
so no direct baselines to compare before and after that time.
Yeah. I had a patient not long ago, actually. I can't recall what cancer they had, but they were having chemotherapy. And they actually did a kind of a test because they felt really terrible from the first couple of rounds. And then they'd read, it wasn't my suggestion, they'd actually read just online themselves that keto could help. And then they went keto, and then they actually had a much better outcome. And I've heard this on other people's podcasts,
Yes,
as well,
well,
that keto really seems to help with the chemo.
absolutely. Well, I think I think it just makes sense that with the metabolic theory of cancer, which you're no doubt familiar with, that if glucose is a major fuel of cancer, then keeping your insulin levels down low and keeping your carb intake down low and having that low, glucose to ketone index, having that ratio optimal, and it just makes sense. I think that you take away one of the fuel sources that you can. That's a little harder with glutamine, which is another fuel source. But yes, I think it is definitely something that just makes you feel stronger and without having that metabolic dysregulation, because it certainly lets that inflammation be really low, and keeping that low just helps the body in so many other ways, as well as I think keeping oxidative stress down, because we know that that's really a bypass of metabolism anyway. And over nutrition, and funnily, when you sit there having chemo, they wheel the trolley carts around that are laden with scones and cakes and feeding people up with sugar while they're having chemo is just such a major contradiction. But so many benefits. But I also find that the fasting, and yes, there are some cancers that actually thrive with autophagy, but my particular cancer wasn't one of those. So the autophagy certainly helped, and is said to strengthen the cells that are our healthy cells, and also to then lower the strength of the cancer cells, so that they're more can be better targeted by the chemotherapy. And I certainly found that the case as far as lowering side effects from it all. whereas a lot of people, have so many side effects and complications. And I found even from things like having the double mastectomy where you have drains inserted, and some people live with those for months, usually weeks. I had them out on day 4. I didn't have a problem with that fluid at all. So,
Wow, day 4, that's very early.
yeah.
Yeah, I mean, certainly I see that in practice, with people not particularly breast cancer, chemotherapy and so forth, but just, general recovery, general injuries. People do just seem to be, I think, less prone to injury. Maybe that's anecdotal, but there's not any evidence as far as I'm aware there, but they certainly seem to recover quickly. And I know myself, certainly on carnivore diet now, I mean, my recovery time is just crazy. I had a patient last week who had a back injury. He's a manual worker, and he fell over backwards and hurt himself. And it's not a terrible injury. He could walk around and everything, but he was off work for a good couple of weeks. And when I just mentioned, he asked me what can I possibly do to help me heal a little bit quicker. And I said, look, there's no evidence for this, but anecdotally, it seems to help with recovery from exercise. Therefore, you could try it. And he was pretty keen, so he actually went carnivore for a week, and he went from just this pretty bad back pain, it wasn't really recovering, to just it was almost completely better in a week. And then he said, well, I feel also amazing. I'm just gonna carry on, with doing it, which is great. So let's go back if we can to lipedema. And you mentioned, of course, that low carb and keto can help lipedema. Is that primarily through the insulin and insulin resistance, do you think? Because we don't really know exactly how lipedema really works, what causes it, really how to treat it.
No, but we do know, there are studies that show on biopsy that, there is a lot of inflammation, as there is with obesity, similar in that way, in that you'll find these hypertrophied adipocytes. So the fat cells are becoming larger than they should be. And so that initiates an immune response. And so the body sends in these immune cells, these neutrophils, to try to fix what's going on, which is what is the body does to help with acute inflammation. It says does this inflammatory response, the body fixes it and everything goes back to normal, but the body can't fix it, so it keeps sending cells to help with that. And then macrophages are sent in and we get these crown-like structures, which can also happen, so these sort of multinucleated cells, and we also get that with obesity, but in lipedema they tend to be very irregular shapes and sizes. And so we know that there's also, this fluid coming in with the tissues, particularly in advanced stages, perhaps not so much in the early stages, but once it starts to become more advanced, that all aggravates inflammation as well. And inflammation left long enough in lipedema can lead to fibrosis, where the tissues go from being spongy to then going to being harder. And so that's sort of all at play as well. So I think anything that's going to help reduce inflammation is going to be particularly helpful. And that's also, of course, having high insulin levels is an inflammatory state to be in. And we know that with ketone bodies themselves, have medicinal qualities. So studies do show that the ketone bodies, in particular beta-hydroxybutyrate, interrupts the inflammasome pathway, so that NLRP3 pathway, that ketones can really help to lower that inflammation, which is why it's particularly good. So low carb will still be helpful because you're taking away the bulk of taking away the processed foods. That's going to help anyone. And also reducing some of the carbohydrate load is going to help as well. But then the thing with that I find with women with lipedema, predominantly in my clinic, will have a relationship that they can no longer control with carbohydrates. So as I was saying before, low carb can be great for a lot of people and is enough to do healing and to get them back on track and to get their metabolic health going. But for people who have a relationship where they can't they can't moderate their carbohydrate intake, it often takes complete abstinence to heal that relationship. And so some people think, oh, look, I have a sweet tooth. I couldn't possibly go without. It would be too hard to go without those foods. Well, I think they usually are typically the people that need that and actually need to separate from them, because it just keeps feeding the addictive pathways, and separating from some of those things that feed into that is really what helps to repair it.
Yeah, absolutely. I mean, I've spoken myself previously on this channel about my issues with carbohydrates, and I've come to accept now through the carnivore diet, it's kind of opened my eyes really to my own issues, and I'm just addicted to sugar. I can't moderate. I lack that ability. Whereas now and so I always struggled with low carb. I struggled with keto. I loved it. I felt amazing. And I do it for a while, but I always came off because I would be that person that kind of just, well, so low carb, I can have 70 grams maybe. So I'll eat 70 grams, or I've only had 69 today. I'm going to have another gram, I can sneak a gram. Keto would be like, oh, well, I probably should have maybe 30, 40. And, oh, well, some sites say 50. So I'll just do 50. And, I can do 51 today, and I'll do 49 tomorrow. Of course, then I just do 52 tomorrow. And then then I can just do low carb anyway. I don't have to do keto. And, I just kind of creep. And I just lack the ability to moderate. So for me, carnivore, of course, is a ketogenic diet in its nature, but then it's just as close to really zero carb as kind of humanly possible. And for me, that's just, and I've used this word before. It's just freedom. It's food freedom for me. And this is where I do take issue with the kind of the quote unquote balanced diet, everything in moderation, because you're asking people to moderate hyper addictive foods. We know that people struggle with that, and if there's people out there listening to this saying, "Oh yeah, but I can just have a Tim Tam and it's fine," I can just eat one. Well, great, really for you. Most people can't. A lot of people struggle, and we have to recognize that some people do just have that sugar addiction, and it's not their fault. It's a very real thing.
Absolutely.
Certainly, there are studies out there showing that sugar is as addictive, if not more addictive, than cocaine.
That's right. And those addictive pathways, not only includes alcohol, cigarettes, caffeine, sugar, dairy, flour, it includes quite a number of foods. And the more in that combination that you have at the one time. So, we know that with the fats and the sugar and all of those combinations, but some people can really overdo the dairy, for example, and can actually have that addictive sort of side to that with dairy. So you might say, well, dairy could be really great for people with carnivore, for example, that it offers it helps you get a better nutrient profile and can really add in some nice things. But if that's feeding into your addictive pathways, and that's something that you need to regulate. So that's something we need to keep in mind. But I think this thing, for women with lipedema, it's very much a double-edged sword, I suppose, because a lot of women aren't eating enough. So it's different to obesity that often comes from overeating, but not always. And there are some people who, we know that weight gain can happen from undereating as well. It doesn't just straightforward mean that you're overeating.
Yeah.
But women with lipedema have often done so many diets out there because it is really difficult to have large legs. A lot of people can still wear great clothes and they might have that weight around the middle, but to have legs that really can be confronting, particularly as they advance, it really changes the appearance of your legs. So they try every diet out there, which of course doesn't work, or it works. Calorie restriction, of course, will work for anyone initially, and then you lose weight, but the rebound weight gain will happen. It won't necessarily work for women with lipedema who don't really have any normal fat to lose. So if they simply have lipedema fat in their legs, then they will just become emaciated and take the weight off their upper body that they perhaps already don't have weight to lose there. So telling these women to eat less can actually be more harmful. And we know lipedema weight doesn't just respond to calorie reduction, and most calorie reduced diets include a lot of foods that still feed the addiction. As we know, that's what keeps people hooked to those diets. So you're still feeding the insulin and that fat cell growth, and you're still feeding the inflammation, and so that's not very helpful. So for people who have done that, if you've been dieting meticulously for months and it's not working, or you're starting to then put on weight and craving carbs, which is where generally people think they've lost their willpower, but actually it's just your body's hormones taking over and upregulating your hormones, your hunger hormones, and your carb craving hormones. That's it's debilitating, and so women will then tend to emotionally eat because they think, well, I'm now craving all of these foods, and that can lead to binge eating disorder. And emotional eating too, because you want that instant gratification. You want to feel better, and going to doctors and asking for help, or going to anyone and asking for help and not being given answers, trying everything you can but nothing's working. It is, it's just such a difficult place to be in, and so we know that can really tap into to strong emotions. And particularly if people don't have healthy ways to deal with strong emotions, we know that food is an easy way to deal with just about any type of heightened emotion.
Mm. Absolutely. I mean, we turn to food for, we feel happy, we eat, we feel sad, we eat, we feel joyful, we eat. We turn to food for emotions all the time. You're absolutely right. I mean, it's pretty soul destroying for people to go to their doctor, asking for help. It takes a lot of courage to go to the doctor and ask for help, especially for anything that's around weight or perceived to be, weight issues, or fat issues, because there is a lot of fat shaming that happens in the medical community, and across society. And so often then, people will get a negative experience because the doctors just assume, well, you're just fat and lazy, and I'm just not going to bother helping you because you clearly can't help yourself, which is a terrible attitude to have. But some doctors do seem to have that attitude, or at least that's the take home from the patients. Maybe it's a communication error, but at least that's the perceived message that people get. Or they just get told, eat less, move more. Which of course we know just doesn't work, and clearly for lipedema, as you're explaining, of course, as well, it's just even less that it's going to work. So it takes a lot of courage for people to go and then see their doctor, and then it's such a shame they kind of get this advice, which is a real problem. Do you see with lipedema that it's linear, like the less sugar you eat, the more it improves, or is kind of low carb as effective as keto, assuming that someone can stick to that?
Well, it's hard to say. As far as the actual lipedema weight, we're not talking about that, of course, because we can't, we don't have studies that actually measure that, and studies are very low. And I have co-authored a paper on ketogenic diet as a potential intervention for lipedema, but we don't have follow-up studies on those types of things yet. And we're gradually getting there. There are more and more pilot studies being done and other clinical studies, but we don't have a lot of results. I do find that women do better on keto, and mostly for that reason that I've only met probably a few women who feel like they can control their relationship with carbohydrates, and of those few, they tend to be people who hit the gym hard. So they're over-exercising and they're playing out, I think, that overcompensating in that area, so that food is not an issue for them. And that's just my experience. I'm sure there are a lot of other, things in between that fit with that. And of course, people are coming to me because they want to deal with their weight. So that's the end. That's the group of women that I'm seeing in my clinic that you would normally see asking for that help. So of women who aren't looking to lose weight that I've not spoken to, of course, I can't speak for that subgroup. But we do know that because we're dealing with a lot of inflammation, and because ketone bodies actually do help lower inflammation, and I guess even from the fact of, I definitely do see people report lower pain lower pain when they go keto. And for some women, that's quite drastic. I've spoken with women before who have been about to go onto morphine patches. The pain in their legs has been so intense, and with just no reprieve from it. And of course, that also that affects your life. And I've had this happen to me with the weight gain that I had. And some people, I certainly don't look obese, but just with that weight gain that I had, I register as obese on my BMI because most of the weight is carried in the legs. It doesn't matter that my waist is small. It's not a very good measurement, but it's it can be really hard to even want to stand in the kitchen and cook good foods and things like that. Because it's painful to stand on your feet for a long time. But keto, for some women, they get up and notice it the next day. As soon as they've gone into ketosis, that pain levels have dropped. And for some people, it means coming off pain medications, which is fantastic. And so, of course, depending on what else is contributing to the pain, that's not a guarantee that everyone will have no pain if you have lipedema and go keto, but it's certainly a big help.
Yeah, absolutely. And you mentioned, of course, there are a couple of times ketone bodies being highly anti-inflammatory, and BHB, beta hydroxybutyrate, is one of the main ketone bodies, of course, that's produced. And certainly, this I've heard other podcasts, talking about this, of course, particularly as it pertains to a carnivore diet. And of course, everybody then says, well, you're not having any fiber, you're going to get bowel cancer. There's the papers that look at the risk of bowel cancer and reduction perhaps with fiber talk about using the anti-inflammatory effect of butyrate, which is the kind of fibers broken down in the gut to then produce butyrate. But a carnivore diet, you're going to have so much butyrate circulating all through your body, including the colon. You're going to be far, far more than you're going to get from breaking down a little bit of fiber. I just thought I'd just throw that in there just in case anyone heard that. I wanted to do that. To look into that. Speaking of carnivore, obviously we've spoken about low carb, we've spoken about keto. Do you talk about carnivore diet at all with your patients? Just taking that one step further.
I do. I don't tend to use it a lot. Some women will come to me specifically wanting to do carnivore, and we will do that. I have a lot of people, though, who don't want to be that severe, or that it may be that they just want to include a few other things. Quite often I'll eat very close to carnivore, but not quite carnivore, so I don't put a lot of focus on vegetables, and quite often I will just have meat and eggs, or some dairy, and like to keep it as close to carnivore as possible, but I'm not strict with that, and I don't necessarily aim for that specifically, but I do feel better without having a whole lot of fruit and vegetables. So I think for everyone it's different. One of the issues I find is that women with lipedema can have problems with histamines. And so this is where we start to get into other areas of food intolerances, and which way of eating do you go to there? Because, for example, beef tends to be a very highly consumed meat product when we're talking about carnivore. But actually, beef is a very aged product, and anyone with histamine issues, that can really aggravate. So it tends to be something that I take out of the diet when I'm helping women go through an elimination phase. And so that will be for people who have a lot of histamine symptoms, and have seasonal allergies, and other symptoms that really kind of show that there's some histamine problems there. So that's sort of how I tend to navigate it. So when you're taking a lot of things out, you want to be able to put in there what you can and get people to a point where they're no longer having symptoms. And so some people choose to use a carnivore diet to do that, and some people react really well to that. But I think it's a little trickier when you're dealing with other intolerances, that you need to kind of navigate through those types of things. So I'll tend to have people who use some vegetables and some dairy if they can. Some people can't do that, but certainly tend to focus on things more like chicken, for example, which has its pluses and its minuses. As we know, chicken can be really high in linoleic acid, and it can be quite inflammatory, but it can also certainly have anti-inflammatory benefits too, in as far as getting you into ketosis. And some people that are reactive to other things it's, you have to choose a lesser evil. So we try to promote just the best quality as we can, certainly with things like chicken and pork.
Yeah, no, I think that's a very good point, and I guess it comes back to what are you trying to achieve with the dietary changes? There's no point saying, right, okay, we'll cut out all the sugar, but then go and have all these other foods which are going to potentially cause you problems. And this is what I say, say to patients. I had someone come the other day, they wanted to start carnivore and they wanted to know what should they eat, how strict should they go. And I kind of just said to them, well, what are we trying to treat? What are we trying to achieve? And then let's use that as a guide. If we want to maybe achieve weight loss, well, it's not really a weight loss diet anyway, but most people will lose weight, but we don't need to go necessarily as strict. If we're trying to do a kind of a full exclusion to see if there's anything in your diet that's causing your issues, then yeah, we need to kind of go, really as exclusionary as we possibly can. So I was kind of saying, let that be your guide, depending on what we're really trying to treat that. As you're right, beef often comes aged. And I was listening to a podcast the other day and they were talking about very good advice, actually. I didn't really think of this before. Mince. Often people put mince, they leave it in the fridge, covered or uncovered. I don't think it really matters. And it can age in the fridge. And then it can release quite a lot of histamine, I think, on relatively a lot more than just like steak, for example. So they're saying, cook the mince, put the rest in the freezer, get it out, cook it again, put it back in the freezer.
That's right.
As you need to, because otherwise, then or break it up into small pieces first and freeze bits and cook bits.
That's
so it's not aging.
Yeah,
it's not aging. And slow cooking, of course.
Yeah, sorry, any leftover foods will actually increase histamines. So, having leftovers of any kind, you really want to get into the freezer as soon as you can. But the other thing to consider too is how long do you remain carnivore? And if someone's just eating muscle meat and steaks and lean chicken breast, well, obviously you need to address those types of things. Well, some people will be more reactive to eating meats, like chicken is a classic example if you're eating the fats with that we often recommend, but it's also the place where an animal will store toxins in the fats, so that can be problematic for some people too, and so there are tweaks like that. But also we have to look at getting the right amounts of collagen and glycine versus muscle meat. So that's something else that you need to consider. Is someone prepared to get the full kind of variety of your need of organ meats and bone broth and those things that we know really need to be supplemented in carnivore to get a really good overview of nutrients?
Yeah, I was going to mention bone broth there. Of course, bone broth, typically is very high in histamine.
Yes.
So that is often then an issue as well. And I've got a number of patients with Ehlers-Danlos at the moment, and struggling. They're lovely patients. They're obviously struggling with Ehlers-Danlos. Often they have histamine issues,
yes.
Mast cell activation syndrome, POTS. Most of them tend to just have the full gamut of things there.
Yeah, and that's common with people with lipedema as well.
They struggle.
Yeah.
Yeah, they of course struggle with that histamine, which really can be a big issue. Speaking of, obviously nutrition, I'm keen to know if you explore zinc at all with patients, because we know zinc can lead to higher insulin levels and higher insulin resistance, which of course we're trying to really treat with the low carb and keto there. Is zinc something you talk to about with your patients a lot? Because very, very common deficiency, especially here in Australia.
Yeah, absolutely. And, it's, I don't tend to test zinc a lot necessarily, because a lot of places aren't really happy to test red blood cell zinc, and you can get very fluctuating levels with testing serum zinc levels. So I don't tend to do that a lot. But it is absolutely something that we will look at trying to include zinc foods. And if people aren't happy to eat foods that are high in zinc, then it is something that I will typically supplement with someone, that it might just be, here, have a bottle and finish it, not necessarily to take for the rest of your days. Zinc is something that you need to be careful that you're not having too much of. It can disturb copper balance, and you certainly don't want to be taking really 50 milligrams or above, for example, because that is going to cause a copper disturbance. But it is such an important nutrient. It's important for thyroid health, prostate health, any kind of gland health. and so much more. Obviously your immune system, and I mean the list is endless. It's a cofactor in different processes throughout the body, and it is definitely something nowadays that we don't have as much of in our diets. So yes, if people aren't eating those specific foods, it really is something that needs to be included somehow.
Yeah, absolutely right. I mean, zinc is involved in so much in the body. I mean, insulin and insulin resistance is just one small part of that. Of course, probably people have heard, take zinc if you have a cold. There's a reason for that. It doesn't really do much when you actually have a cold, but evidence shows you have to take a lot of zinc, so much it'll probably kill you. At least you wouldn't have a cold. But yeah, certainly, it does boost the immune system, or rather, a low level will reduce the immune system. I think maybe a more accurate way of saying it. Low level of zinc can increase, cortisol levels and stress hormones, which we know can have an adverse effect on the body, of course. And of course, our sex hormones, testosterone, estrogen, progesterone, all require zinc, to be produced as well. You're definitely right, though. I mean, usually I recommend about 30 milligrams if I'm looking at a tablet, 30 to 40 at most, because people, when they're taking 50 milligrams of zinc, they can start to then outcompete the copper. And then copper can become an issue. And that one's tricky because copper deficiency or copper excess even, the symptoms can be so wild. It's very hard to pinpoint. And, most doctors probably wouldn't even know, what copper is or what it does in the body. They probably wouldn't even know or have a clue, that this could be copper deficiency. So that can then, present its own issues as well. And of course, a lot of supplements, they'll start at 50 for the zinc. So you have to kind of seek out the ones that are actually a little bit lower. Yeah,
That's
zinc,
right.
zinc
Yeah.
can certainly
Otherwise, you
be an
need to
issue.
supplement copper with it. But if someone has high copper levels, that can be really problematic, and that's kind of doing more harm than good. So yeah, you either need to be testing, or you certainly would test copper levels before you would supplement it. That's for sure.
Yeah, absolutely. I'm keen to know if you use any other kind of treatment, or you recommend any other treatment modalities to try and get the ketone body production up. Because we've spoken about low carb and keto, and of course a little bit into carnivore there. But I've been getting lately into cold water therapy, and
Same.
I don't have like a plunge bath or anything. I can really do it in. So kind of just standing in a cold shower for 10 minutes a day. It's absolutely amazing. I mean, it's just, it makes you feel so good. But I was reading all about. I think, I'm going to do some research into this. What is the benefit? Like, is there any physical benefit, or is it actually purely just kind of placebo? But I was reading all about potentially increasing ketone body production, and potentially switching on, maybe brown fat as well, which is really interesting. I wonder if you ever mentioned anything like that to your patients.
Well, I'm definitely starting to, because I've been doing cold therapy myself lately. So I've joined a
Have
dipping club in
you?
the town I live in. We dip in the lake every morning at 7 o'clock in the morning. We go in for 5 minutes, and I've started over summer so that I can work my way through winter. So I've started a good 6 months before the really cold weather so that I can, yeah, get through then, because of course the benefits just get better over winter. And I walk down by the lake at 6 o'clock in the morning over winter. So it's not that big a stretch to just kind of dive in and back out for 5 minutes. The first day I joined, we actually did an ice bath. And when I first walked up, I said, "Oh, I'm not doing that." And then by the time I'd watched a few people hop in, because I just thought, I don't have to start that far on my first day. And then I thought, well, why wouldn't I just jump in? I can jump straight back out if I want. And so I lasted nearly a minute before the pain on my hands and feet got to, or the intense sort of burning almost, it feels like, which you get used to over time. But just that intense coldness is quite a bit of a shock to the system, which is part of the benefit of it. It's the shock proteins and things that it helps to release. But it has definitely helped me. My energy levels haven't quite been
Sorry, that's my
okay.
kid screaming in the background. I'm sorry if you heard that.
Since post chemo, my energy levels have certainly never quite recovered. And if I have really big days, and I work on in research and things as well, and if I have a really big day, I really struggle to back that up with another big day, which is really frustrating when you're a busy person with a lot of projects on the go. And since I've been, and sort of post COVID, I think that almost made that fatigue a little, it worsened it. And so I was really struggling with what felt a bit like chronic fatigue for a little while. And then I started this dipping, and it has really helped to combat that, to the point where if I do the walk and the dip, I'm absolutely full of energy. And, it's really quite a turnaround. So the benefits, as you say, are really beneficial, I think, for women with lipedema and lymphedema. And this is my personal opinion because there is nothing to substantiate this. But having dilated and leaky blood vessels and lymphatics, I think having something that helps to counteract that is helpful. That's certainly how it feels to me. And I tend to be more heat tolerant on the really hot days when I'm doing that. So I find that to be really interesting, and I'm not perhaps getting as much swelling. But there is also things like, it helps to raise, lowering insulin, and the cold therapy helps to raise uncoupling protein 1 in the fat cells, which means that the fat cells can then not only perform one function, which is the fat storage, it can then also perform 2 functions, which is also the thermogenesis and heat production. So that, I think, can be, is a potential great benefit area to be explored for women with lipedema, but certainly beneficial for everyone. I know I've had my DNA analysis done, and I have a lot of obesity genes in my family, and have that propensity to a lot of white fat cells that aren't beiged and are only acting as fat storage, and obviously hormone signaling and things as well. But as far as energy-wise, acting in that fat storage phase. So, and another study that was released only a couple of weeks ago that talked about it improving glutathione production. And glutathione is our body's master antioxidant and helps to combat oxidative stress. And so when we talk about longevity, things like that can really influence that. So there's certainly, tons of benefits.
Yeah, is it painful with the lipedema? Because I know, very 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 cold water can feel painful anyway. But do you think it's more painful than it should be with lipedema? Because there's probably people out there thinking, "Wow, my legs are already really painful with lipedema anyway, and now you're expecting me to go and jump into an ice bath." This lady's crazy. Is it more painful, do you think, or less painful?
Yeah, hard to say. I can only go by what I've experienced, because it's something that we've yet to get any real feedback from the lipedema cohort. But some women with lipedema do find that the skin is very cold to touch, and I don't have that in my legs. And when I went into the ice bath, I actually, because I've had a double mastectomy and I haven't had breast reconstruction surgery, and because of my legs, I now wear sort of exercise pants down to my ankles, and I wear a rashie that goes down to my wrists whenever I go into the water. I don't tend to wear bathers anymore. And so the only parts that the ice hurt was, or for me, that burned, I should say, rather than hurt. It's not really a hurt. It's more just a burning sort of sensation, was my hands and feet that were actually exposed to the ice. So the parts that had the rashie on and the long pants didn't have that same effect. It was just the hands and the feet. Yeah.
Yeah, no, just interested in your take on that. Certainly, I started doing cold water therapy, and not like I said, I'm not really dipping in freezing water just in the shower. But up here in Bristol, the cold water is not really that cold anyway. But it certainly, it certainly seems to just wake me up. It really makes me feel good. It's definitely improved my energy levels, and my energy levels were really amazing, on carnivore anyway. But I've started doing it twice a day, morning and night, and it just really just wakes me up and just makes me feel amazing, which is great.
Yeah.
You mentioned earlier before we started recording that you are that you've got a book, and you're also co-authoring another book.
Yeah, so I have co-authored a recipe book for lipedema, which was designed for the holiday season. And at the moment, I'm working on it's called a guide to medical tests for women with lipedema that I'm working on with an endocrinologist from the US who is considered one of the world's leading experts on lipedema. She specialises in rare fat disorders. and yeah, Dr. Karen Herbst. So we've been working on that for some time. I started pre-sales of the book in June last year. I was hoping that we would have that finished only within a few months of that date, but all kinds of other pressures come up, and so many projects that you're working on, things get blown out. So we're trying to finish that up in the moment. So hopefully that will be released in the next sort of 4 to 8 weeks, which will be terrific, because at the moment there are no tests to diagnose lipedema. So it's not a book that's there to help you diagnose lipedema, but it's certainly there to help women navigate their health, with women with lipedema navigate their health. Because at the moment, if they're going to a doctor and say, right, I've been diagnosed with lipedema, and the doctor says, okay, well, what would you like me to test? And they say, well, I don't know. And the doctor's like, well, I don't know. And they're kind of, not quite sure what's going on. So we kind of say, okay, well, there's common comorbidities with that. And if you test these things and this happens, then you might want to test these things as well. But, obviously there's other things that we want to look into as well. Like even, as far as making sure that women are testing, setting baselines for bone health and those types of things as well.
Yeah, sorry if anyone can hear screaming in the background. My kids are obviously the films ran out. So all 3 of them trying to come in the room now. So obviously the door lock doesn't seem to work very well. Never mind. Yeah, I mean, it's really important. Obviously, when you come to these things, there's doctors don't always know what to do. Doctors don't always know what test to do, and it can be difficult there. Obviously, and it's very, very important that people, the doctors also and patients can get a sense of what blood tests might be useful for them. Because very often, people have these medical conditions and they go to the doctor and say, look, I think I have this issue, and the doctor says, okay, what do I do?
Yeah, that's right.
And then the patient says, I don't know, like you're the doctor, you tell me. And the doctor says, well, I don't know, I don't even know this condition even exists, or
exactly.
There's nothing we can do, or because medical school can only cover so much.
Yeah.
Often a lot of what we learn as doctors is kind of on the job, learning, because you've got textbooks, of course, and so forth, but they can't cover everything, and certainly not in the level of detail that you need. So a book, for people that can actually go into the doctor and say, look, I've got this thing. These are tests that might be useful for me. These are treatments that might be useful for me. That sounds like a really, really very good idea. You mentioned, of course, some pre-sales. So how can people find the book?
So they can find the book on my website, which is ichoosehealth.com.au, and you can still order pre-sale copies. Yeah, until it's released, which is hopefully very, very soon.
Fantastic. Hopefully soon. Yeah, it sounds like it's been a while in the making. So I'm sure that'll be a really good book. And anyone out there that's struggling with lipedema certainly should go and check that out.
Yes, because it also talks about, just to finish that off, it also does talk about nutrient deficiencies and what are common for women with lipedema. Because, for example, vitamin D is very common to be very low in women with lipedema. And so that's super important that women have those things tested, because, as you know, vitamin D is just important for so many things, not only, bone health, but energy levels and all the types of things, the immune system, everything that's going to help, with insulin metabolism. So there's a lot of things there that people need to consider based on, okay, well, if you've had bariatric surgery, for example, that's something that you need to take into consideration as well. Well, what is the scope of what you'll be low on? And it's not sometimes just as easy as taking a multivitamin and everything will be fine, because, as we know, multivitamins are loaded with things like calcium, magnesium, and iron, because they just pop everything in there. But those things all compete for absorption, and so you might need to make sure that you're perhaps getting those things elsewhere, or taking them in the right combinations and timing.
That's right. I mean, a lot of people do just rely on multivitamins, but then they don't realize that maybe they've got competing things in the same product, or that actually they're trying to get their let's just say, for example, they're trying to get their copper levels up, but then the zinc's already high. And then they're supplementing more zinc in their multivitamin or multivitamin. the copper can go down even more. That's just one example. But vitamin D, of course, we know that the biggest form of that is from the sunlight, of course. Some people will need to take that vitamin D tablet. Do you notice if people can improve with lipedema with taking vitamin D? And is there a certain level that maybe people should be aiming for in their blood test, for example?
Well, I think, in the blood tests, we like that to be up between 80 and 100. So, just being in the range is definitely not enough in vitamin D. You really want to be up near the top end of the range. You don't want to be super high either, because that can be problematic as well. But certainly usually 80 to 100 is where we like to see it. There can be a lot of contributing factors to vitamin D. For example, is it someone who also has an autoimmune disorder that you might think about differing levels as well? But the other thing is, how much weight is someone carrying, because vitamin D can be sequestered into the fat cells. So it might be that you don't have as much circulating vitamin D, and you need to take that into account as well. And then, by the other token, if someone is in a weight loss phase, that you need to monitor it as well, and maybe start reducing vitamin D levels as it goes the other way, as you would with other, medications, for example.
No, absolutely. I'm conscious of your time, and we've been for an hour or so now. Is there anything that we haven't spoken about that you would like to mention to our viewers and listeners?
Well, I think just to finish off with lipedema, that it is certainly something that, we're really aiming to help to stop progression is the first place. So aiming to stop that, to reduce insulin, to reduce the rapid weight gain, and certainly the lifestyle weight that can really accompany that and make things worse. Because if you get too much weight gain, lifestyle weight gain with lipedema, it can progress into lipolymphedema. So you then get that secondary lymphedema, and that can cause a lot of complications as well. And then you start to really, be losing mobility and so forth. But the other thing that's important for people to know and to give them hope is that there are other conservative treatment methods that can be really helpful, that differs to obesity as well, because it's things like to deal with the leakiness that we get in the capillaries. So conservative treatment can include things like compression garments, is really helpful for anyone with lipedema, depending on what stage you're at as well. But certainly for anyone with lymphedema in the mix, or anyone who just has lymphedema, compression garments, are a huge component to that. And then there are other conservative measures that can help as well. And of course, some people choose to have surgery, lymph-sparing surgery. You really want to be making sure that you're going to someone who really knows what they're doing and is familiar with lipedema and lymphedema, not just a cosmetic surgeon. And so I think that's the main thing, to go to a physio. If you think you may have lipedema, you can head to lipedemaaustralia.com.au. That's a fantastic website that will have some great information. And you can also speak with a doctor who is familiar with lipedema, or a physiotherapist or a lymphedema specialist who are familiar with lipedema. So there's a few different places you can go to. To try to get some more information on it to get a diagnosis.
Yeah, absolutely. And of course, you're on the advisory board, I think, as well, you said, for the Lipoedema Australia. Is that right?
That's right, yes.
Yeah.
Yes.
So, I know from your bio, there's so much we haven't spoken about, that you also help women, or people that women, of course, with, through low carb and keto. You mentioned, of course, lymphedema a number of times. We haven't touched on really that much today. Obesity, type 2 diabetes, of course, and breast cancer. So perhaps if you're willing to, we can get you back on the show at some point and talk about those other aspects there as well. Would be great. How can people find you? How can people get a hold of you? Of course, we've already mentioned your website, but just for the listeners again, if you can maybe just reiterate that.
Yeah, so if you hop on the website, you can certainly look to do a strategy session with me. So one of the things I think is frustrating for people, particularly if you've tried so many things out there, it's a lot of money to manage these conditions. So I offer a 30-minute free consult to have a chat with people and let them know how I think I might be able to help them. But it also gives people the opportunity to think, well, are you the right person for me? You click with some people and not others. Some people, you need to kind of feel like you're identifying with someone and that they're really hearing you and getting where you're coming from. So feel free to book in for a strategy session for anyone listening who thinks that they may have this condition or anything associated with, type 2 diabetes or breast cancer, that, I'm always happy to chat with people.
Yeah, and that's ichoosehealth.com.au, is that right?
That's it, yeah.
Perfect. And are you on social media at all?
I am, yes. I have Facebook, which I tend to under my own, under Megan Pfeffer, or I do have I Choose Health Megan Pfeffer, Instagram, or Facebook, Twitter, and LinkedIn.
Perfect. Well, I'll put all those links in the description for the episode anyway, of course. And it's Pfeffer with a silent P at the start. If anybody's frantically Googling Megan now to try and find her, it's Pfeffer with a silent P. Well, thank you so much, Megan. This has been absolutely fantastic. I've learned a lot today. Hopefully our listeners have as well. Lipedema is something that we certainly can, we certainly do see. It's not something I've seen very much of myself as a doctor. So, but I think, as you said, it is probably more common than perhaps people realize. So if anyone out there is struggling with what they think is lipedema, definitely, perhaps book one of those consultations with Megan so you can have a good chat to her and see how she can help. Thank you to everyone for tuning into this episode of the Meat Medic podcast. Thank you so much, Megan. This has been an absolute pleasure talking to you today. All the best to everyone out there. Have a great day.
Thank you so much.